Good afternoon, ladies and gentlemen. My name is Ben Atadil-Bol, and I'm the president of the Queensland African Communities Council. So I believe many of you have already heard about the changes that have been announced by the Queensland government on Saturday and again today. So I also do know that many of you would be wondering as to why QACC is also recording and sharing this information when you have already been bombarded with a lot of information. I know that. I know how frustrating it is. I know how much information is being shared in the community. But we equally need to understand the seriousness of the situation. So we have to share the information with our community. And we are doing this for the following reason. Number one, we do know that more than 90% of the African languages have no accreditation. And as such, they do not have certified translators. So we have been relying on volunteers, ethnic community leaders, translating those messages to their own community members. So what I'm trying to say is that you are the most important person in our community because you speak a very unique language and you know your people. So no matter what we do and you don't cooperate with us, with the government, with other key stakeholders, your people will not get the information. And what we want is make sure that the same time the announcements are being made and everybody else is hearing the information, it is the same time that we want our community members to hear the information. Not after 2 days or 3 days waiting for the so-called simple English version. No. We also want to make sure that it doesn't matter how many people, how many members of your community speak the language. It doesn't matter because this is about health. Even if there are only 2 or 10 people in your community, they have to hear the information. So we want to make sure that everybody get the information, reliable, accurate information on timely basis. So today, I will be calling upon Abiba Andria, who is our public relations coordinator, and at the same time, the African Youth Support Council coordinator, to come and run through the changes that have been announced by the government. And again, I just want to make sure that please, let's take the responsibility in our own capacity as leaders, as individuals, to keep our families and communities safe. Thank you. Abiba?
Good afternoon, and thank you, Benny, for the introduction. So, as you already mentioned, a lot of you guys already heard the news about the COVID spreading in Queensland. Many more people have been found to have COVID in our community. So for this reason, the government has announced the lockdown will continue until 4 p.m. Sunday, 8th of August. Please only follow the following rules when during lockdown. Only leave your home to buy food, medicine, or attend a doctor or health appointment. Exercise in your local area within 10 kilometers of your home. You can exercise with people you live with or one other person who does not live in your home. Go to work if you can't do that from home. Provide support or look after another person or family member. Get COVID test or vaccination. You must carry a mask with you at all times. You must wear a mask when you are leaving your home or when you're outside. This new type of COVID is called Delta. It spreads very, very fast and easy to pass on to your family and other people in our community. If you have any of the following signs, fever, sore throat, runny nose, cough, diarrhea, shortness of breath, fatigue, so that's feeling weak or tired, loss of sense of smell or taste, vomiting or nausea, so feeling really sick. So if you have the following signs, it is very, very important to get yourself tested straight away. After you do get your test, do not go to the shops or anywhere else. Go straight home and stay at home until you receive your test. Once again, let's please help keep our community safe. Thank you.
Thank you very much, Abiba. And again, I just want to reiterate the important role of the ethnic community leaders who speak very unique languages in the African community. So it's not just about all those languages who have not been accredited or have no certified translators, but it's also about the languages that are being grouped. For example, Arabic. We know very well that when this translation version in Arabic, this Arabic, Sudan Arabic, Juba Arabic, Iraq, Lebanese, and all of that. So it is up to you as community leaders to make sure that when you see the message, you need to translate it in a language that's unique to your people so that your people actually understand it. The same thing even with the Dinka, for example. So there are certain words in Dinka that other Dinkas may not understand. So if you are an ethnic community leader or you are a leader of a section of that particular tribe, so make sure that the information is understood by your people. So that's the most important thing. And everybody out there who is not a member of your community, they don't understand the complexity of your language. They don't understand what's involved in there. So you are the most important person. So you need to get the right information from the government, from the QACC, because we work very closely with the government. We get the right information and make sure that your people are not relying on conspiracy theories on social media, because those are unreliable sources. So it's very important that you work very closely with us and we work with the government to make sure that you get the right information and making sure that you pass on that information to your people, because you know them better than anybody else. You know that your language is not accredited. You know that you don't have certified translators. You know that you don't have enough translators for your language. You know that your language is being grouped into one bigger translation where other members of the section of your language don't actually